I went to Lowe's and bought a refrigerator, and a lady there who sold it to me said, "I would like for you to give me a review." And in the end, I wanted to give a review, but I left the store and I never really did the review. So I think the fact that I have a mechanism to give a patient an opportunity to give me a review right then and there means that I'm getting a lot more reviews than I probably would. My name is Joseph David Stern, and I'm a neurosurgeon in practice in Greensboro, North Carolina, and my practice's name is Carolina Neurosurgery and Spine Associates. So right now, I think that patients are still finding me in the same way, by word of mouth and also by doctor referral. I think the big difference is that the internet is a tool that patients use to validate me and to confirm that, yes, I really do want to see this person. I think also the word of mouth referral through the internet has expanded, so it's not directly people that these people know, but that they go online when they are told they need a neurosurgeon to find, is this someone they should see? Or sometimes I'm actually seeing patients that have been referred to other doctors and they say, I really didn't want to go to that person, or I went to that person, I didn't really like them, and you have a good reputation, so I want to come see you. My personal practice has been expanding really a lot, and I now have, it's more of an embarrassment of riches. I have really too many patients to be able to take care of. I think I've probably been using eMerit for about 4 years, probably maybe even a little longer. But I've been using it. Initially, it sort of sat there. I didn't really use it that much, and now I really do make it a part of my practice. And I find it very gratifying. So I will have a patient who has had a positive experience, or actually one lady the other day said, I want to say thank you. How can I say thank you? And I said, well, here's a way you can say thank you. If you do an evaluation of me, this is helpful for my practice. And so usually at the conclusion of a episode of care, or after someone has come back and has done well with surgery, I'll ask them if they don't mind doing an evaluation. So they show up on all kinds of websites, and more. I'm finding them on more places, doctor review sites I didn't even know existed. UCompare is something I didn't know about. A lot of times they'll show up on Vitals. They show up on Health Grades. They'll show up on Google, and but many different sites. But I've been named a top doctor, a top regional doctor, and I keep getting these awards, compassionate doctor, and a lot of positive feedback from these review sites. So I think that I was initially skeptical of whether it would be of value to me, and I really have found it to be very valuable. It kind of hit home the other day when I had a patient who came from 3 hours away for surgery. She had been recommended a specific surgery, and I recommended a slightly different surgery, but she had come to me, she said, because she had found me online and thought I had a good reputation. So she sought me out. It wasn't a physician that referred her. She came, she actually had a surgery. She did very well. She wrote a review that said, I wanted to thank you and that I had lived up to my online reputation. So that was kind of for me, sort of validating the whole eMerit platform, that not only had she found me through the internet, but then she wrote and said that I had lived up to my internet reputation.